Discussion of a draft ordinance to bring a $25 minimum wage for healthcare workers packed Chula Vista City Hall Tuesday. Some healthcare workers say that base pay would be life-changing.
I work another 25 hours doing a second job just to be able to make ends meet. It's really hard to be able to live here in Chula Vista as a single parent. I've lived in my car.
They call us heroes, or heroes works here, but we're just laughing about it. What's becoming a hero? They're not giving us anything.
And I live in low-income housing. I just applied for food stamps.
Opponents say the increase in pay could have some unintended consequences.
So if approved, this ordinance will negatively impact healthcare programs and services that this community needs and deserves.
The board chair of Sharp's Chula Vista Medical Center says the hospital has been operating at a significant loss for the last 5 years. She predicts this year losses will exceed $70 million.
In the absence of additional revenues, we will be faced with some difficult decisions, including program reductions and service closures.
The proposed ordinance in Chula Vista would increase base pay for healthcare workers to $25 an hour starting in January, while Senate Bill 525 would phase it in, and some health facilities would have more time than others. For hospitals with a high government payer mix, current revisions wouldn't see a $25 per hour base pay until 2033.
One of the things about that state proposal that to us makes more sense is the idea of some kind of phasing in plan. We're still not sure how it will be funded or how it will be paid for. There is no real plan for that.
In its latest version, SB 525 states that proposed city ordinances or ballot initiatives for health worker minimum wages like this one in Chula Vista would be nullified if the bill passes. But that's not deterring supporters.
And I'm just going to point out that I think it's comical that we have CEOs sitting behind us that make millions of dollars and workers that make as low as $17 an hour fighting to make ends meet.
The Hospital Association of San Diego and Imperial Counties estimates that the $25 per hour base pay would increase annual expenses by $20 million for Chula Vista facilities.
I've yet to hear one healthcare speaker come up here and say, we don't want to pay our employees of what they deserve. But it's got to be thoughtful and well thought out.
Hospitals and clinics are calling for an economic impact study to be done. Ultimately, a majority of council members agreed to move the item forward for a hearing next week, knowing that if SB 525 were to pass in its current state and be signed into law, this proposal would be moot. Matt Hoffman, KPBS News.